Greetings and welcome back to PBH 275, Injury Prevention and Control. This week's module covers the role of emergency planning and preparedness in injury prevention. Emergencies and disasters can be devastating for communities and regions. There can be mass casualties, lots of injuries and loss of life that result from emergencies and disasters. And they can be unpredictable as well. We don't always know when an earthquake is going to hit, for example. And for some disasters that we used to have some foreseeable knowledge on, such as wildfires, the seasonality of wildfires, for example, has changed in recent years due to climate change. So even risks like that are not always predictable anymore. And some risks are even unknowable. I mean, you just never know when a civil disturbance is going to happen or a bioterrorism event or anything like that. So any kind of emergency and disaster can be unpredictable and perhaps even unknowable until they happen. Now, with that said, there are many types of emergencies and disasters that are predictable. Or at least if they're not predictable, we can at least know and anticipate that they could happen. And therefore, we can plan for things that we think are going to happen, know are going to happen, or even suspect could happen. And by doing some adequate preparation, we can possibly prevent some disasters. Obviously not all. You can't stop an earthquake, for example, but there's other types of disasters that can be preventable. So the key question for this week's module is, how do governments and individuals plan and prepare for these disaster and emergency events in order to minimize injuries and loss of life and increase resilience to try to make sure that the community can bounce back afterwards? We will start by defining the term emergency and disaster planning. These are the steps that are taken by governments, businesses, organizations, or any other entities for the coordination and management of resources and responsibilities pertaining to, and I'll define these other terms separately in a little bit, prevention, mitigation, preparedness, response, and recovery from an emergency. So as far as those individual terms go, prevention are the activities and training and things like that that take place before a disaster occurs that can actually stop the disaster from ever occurring in the first place. Mitigation refers to the activities that are performed in order to minimize the loss of life or damage to property following an event that could not be prevented. Again, using the example of an earthquake. We can't stop earthquakes from happening, but we can certainly mitigate the damage that's done during them with adequate pre-planning and preparation. As for preparedness, we will define preparedness on its own in the next slide, but this includes activities that have to do with things like incident command and just, things where before a disaster occurs, you have already prepared and decided who is going to be in charge, how resources are going to be allocated, and deployed safely. And you've already answered a lot of questions that will be brought up whenever a disaster is occurring. Response includes the activities that are performed in order to try to resolve the crisis or emergency as quickly and expeditiously as possible. And finally, recovery is what occurs after the emergency or disaster has passed, and you're attempting to assist people with with healing and with trying to rebuild the community and sort of help bring back some of the, obviously you can't bring back lives that are lost, but you can certainly try to help the community build resilience in other ways. And just to reiterate once again, some disasters can actually be prevented through emergency planning. Some examples of this would be chemical releases, inadvertent chemical releases from manufacturing facilities. We actually have protocols in place now that help stop those from ever happening and affecting the community. But obviously, not all disasters can be prevented. Most natural disasters, for example, cannot be prevented. So now let's talk about preparedness a little bit more, because it has a commonly used definition, sort of outside of the relatively narrow realm I just talked about in the emergency and disaster response cycle. Really, it's the steps that are taken by individuals or community members, not just by organizations, that anybody can do preparedness. The steps taken by individuals and community members to make sure they are safe before, during, and after an emergency or natural disaster. Of course, we need to once again reemphasize that local, state, and federal governments are also involved in preparedness. Preparedness was a key part of that sort of disaster and emergency response wheel that you saw on the previous slide. Outside of some very narrow windows of things such as chemical releases, for the most part, preparedness alone does not generally prevent disasters. Again, to the degree that disasters can be prevented. What preparedness does is it gives individuals and community members the opportunity to possibly mitigate the damage, survive a disaster, and then help with rebuilding and resilience and recovery once the disaster has stopped. Very often, a disaster or emergency will also result in a public health emergency, either concurrently or just slightly lagging a day or two behind the other emergency. So a public health emergency means that you have an event that overwhelms the routine health capabilities or capacities in your community. An example would include if you have medical systems that are overwhelmed by a sudden surge of patients, triage will often result. What this means is that only the people who are in the most acute need of care will be able to get it, and everyone else will have to wait. Public health systems, such as safe drinking water systems, can also get overwhelmed during certain types of disasters and emergencies. For example, earthquakes can earthquakes can rupture pipes and cut off drinking water supplies. Flooding events, especially if you have communities with combined sewer systems where both sanitary and storm sewers go through the same pipes, you can overwhelm the water treatment system so that untreated sewage gets released into the drinking water supply. This is why a lot of times after certain types of disasters, there's a boil water order, and you can't drink the water for several hours or even days afterwards because the public health systems got overwhelmed or damaged. Public health emergencies can also occur when you have natural disasters, certainly, when you have pandemics, as we were all made familiar with that concept during COVID-19, or even man-made events can trigger public health emergencies. There was a huge acute medical care crisis in our own valley here in Las Vegas shortly after the 1 October shooting, and there was also a lack of blood because of there was such a demand on the blood banks. So these are all examples of where a disaster can also trigger a public health emergency. There are a lot of known or reasonably foreseeable possible causes for disasters and emergencies, and a good preparations at the community, city, state, and national and international levels should think about all these possible causes and have plans in place for them. These can include things such as winter storms, which often lead to prolonged power outages, tsunamis. Tsunamis can be triggered by other events such as earthquakes, meteor strikes, and other types of destabilizing events. Bioterrorism events, or chemical spills. Another sort of slower moving disaster and emergency that can happen is drought. Here in the southwestern United States, we've been in a prolonged drought for 20 plus years, and if the drought continues and continues to worsen, we could reach a time when it would become a medical and public health emergency, where there could even be civil disturbances or other things caused by lack of water supplies. So these are the kinds of reasonably foreseeable disasters and emergencies that planners need to think about. If we want to simplify the concept of emergency management, we can start by acknowledging that emergencies generally start out as local events. Of course, there are some emergencies that affect multiple jurisdictions and localities at once, such as a hurricane bearing down on the Gulf Coast, for example. But for the most part, when you have an emergency such as a chemical spill uh, or any kind of like utility infrastructural challenge, those start off as local events. Now, as the scale and complexity of an emergency increases, for example, you have an entire state being affected by a hurricane or a huge population basin by an earthquake or by a massive explosion or a terrorist event, something like that. As the scale and complexity increases, local governments will request support from the state government. Whenever the situation is beyond the capability of a state, again, maybe talking about a multi-state event such as a very large hurricane or other or weather event, the governor of the affected state will request the help from the president, and we'll get into disaster declarations shortly and what that means. When a presidential disaster declaration occurs, what this does is it triggers resources from multiple jurisdictions and agencies of the federal government and also of state and local governments, all working together on the problem. A lot of students find it surprising to learn that the federal government mechanism for responding to disasters as we know it today has really not existed for very long. Really has only existed since 1979. Before that, emergency management was not institutionalized and standardized in any kind of way. But it was finally in 1979 with the creation of the Federal Emergency Management Agency, or FEMA. Before the age of FEMA, what would happen is disasters would occur and state and local governments it would be beyond their scope. They needed more resources. So if they wanted to get resources from the federal government, they would have to basically ask their local congressperson to propose piecemeal or ad hoc legislation to open up some money from the federal government. And that would, or they would just have to rely strictly on local actions. So as you can guess, what happened in the era before there was no uniform federal response to disasters was that a lot of inequities occurred. If you happen to live in an area that was affected by a disaster and your federal politicians were powerful and well liked, they could probably get a bill through both houses of Congress and get some money coming in and other resources coming into the area relatively quickly. If you lived in an area where maybe your politicians were not particularly powerful or well liked, it would be very difficult to get any federal help. So this was a inequity problem, it was a social and environmental injustice problem, and now with the sort of a uniform, professionalized agency with its own budget and its own staff to respond to disasters in the US wherever they occur, now there's not as many inequities as there used to be. The establishment of FEMA was a major milestone in improving disaster response at the federal level. Another major milestone occurred in 1988 with the passage of the Stafford Act. The Stafford Act gave us what we all now know as the Presidential Disaster Declaration powers. What this act gave the president the authority to do was to declare a major disaster or an emergency, and when a major disaster or emergency is declared by the president, both authorities and funds for federal response and assistance are unlocked and sent down to states or localities that need the extra help. Now, presidential disaster declarations do not occur automatically. They have to be requested by the governor or tribal leader of the affected region. And a presidential disaster declaration generally does not occur until after a state or tribal government has already responded to the disaster and it's been deemed that their resources are not sufficient to handle the immense problem that's occurred from the disaster. So they put in a request to the president will declare a disaster, and then federal resources are unlocked in order to address the disaster. Another federal power that predates FEMA and predates the Stafford Act is the Public Health Services Act of 1944, which talks about how a public health emergency can be declared, in this case by the Secretary of the Department of Health and Human Services, a cabinet level position in the federal government. When a public health emergency is declared by the HHS Secretary, This permits the spending of additional federal funds to address that emergency wherever it's located, regardless of whether they have powerful politicians or not. If there's something that's affecting the public health, this, this federal funds and federal resources can go to that area. When a public health emergency is declared, the Secretary of HHS may take such action as may be appropriate to respond to the public health emergency. In addition, the Public Health Services Act of 1944 explicitly authorizes the Centers for Disease Control and Prevention to impose federal quarantine for specific diseases. And if you remember from lectures a few weeks ago, we talked about the Jacobson versus Massachusetts court case, which established that governments at all levels have the authority to restrict individual freedom in cases where public health and public welfare would be endangered by the actions of individuals. But this Public Health Services Act kind of codified that a little bit more officially. So a lot of federal resources can be mobilized quickly when needed after a disaster occurs. But the federal government also takes another step of trying to encourage states and localities to do some preparedness planning before a disaster occurs. One of the ways that the federal government encourages this is by tying this type of preparedness planning to funding. A great example of this is the Older Americans Act. If states want to receive grants from the federal government through the Older Americans Act, the state and local aging agencies have to engage in some preparedness planning. They have to have actually written specific plans that talk about how they will coordinate activities with other governments and nonprofit agencies in the event that a disaster occurs that's going to impact older citizens. Unfortunately, we had a relatively recent example of what happens when this kind of coordination does not occur before a disaster, and that's a lot of elderly persons died in the Gulf Coast region following Hurricane Katrina because evacuation orders and plans did not really take into account the needs of a non-ambulatory population that had specialized medical needs. Unfortunately, a lot of these people were just left behind, and that was a clear, just miserable failure of state and local aging agency planning, and really other layers of government failing to plan as well. But if you want to receive federal funding, again, you have to have the plans with specific information, the local plans, the plans that tell specifically what individual cities, counties, municipalities are going to do. They have to be specific. They have to be approved by the states that they're in. And then if states want to receive the federal funding, they have to have plans for all of their jurisdictions, all tied together as part of a master state plan, which is tied to federal funding. For the next several minutes, we're going to talk about one of my favorite pieces of legislation, a piece of legislation that ties together both emergency planning and injury prevention and community awareness. And it's called the Emergency Planning and Community Right to Know Act, or EPCRA. EPCRA covers hazardous chemical facilities and the communities that are around hazardous chemical facilities. When I say hazardous chemical facilities, I'm talking about certainly facilities that manufacture and process hazardous chemicals, but also facilities that use hazardous chemicals. Wastewater treatment plants would be considered a covered facility under EPCRA. Some retail establishments that sell hazardous chemicals and have large quantities of them on site would also be considered covered facilities under EPCRA. Almost everyone in the United States lives close to a facility that is covered under EPCRA. And really, EPCRA was a landmark law in terms of tying these covered facilities and connecting them with the communities around them, including the public health infrastructure and the emergency response and fire infrastructure. And so a lot of great social benefit has come from the passage of EPCRA. I wanted to talk about EPCRA in a little bit greater detail than some of the other federal laws and regulations we covered in this course, just because it was such a landmark piece of legislation and its impact has just been immeasurable. And there are so many potential disasters that have been no doubt stopped by EPCRA because of the emergency planning that occurs, because of the coordination with local emergency response agencies that is mandated under EPCRA, and just some of the communities around some of these covered facilities just having so much more information than they used to have. So people actually know how to respond when the siren is going off, for example. The first thing I will say about EPCRA is that it's an act created by congressional legislation rather than a regulation promulgated by an administrative agency granted powers by congressional legislation. And as we talked about in the role of law in injury prevention lecture earlier, I mean, both acts and regulations, they're both law. They both they're both considered the rule of law. Where acts are a little bit more powerful than regulations is the fact that regulations sometimes get bogged down in court cases by plaintiffs who are challenging the administrative intent of the legislators when they created this agency, whether or not they intended for the agency to promulgate regulations that cover this particular topic. Whereas if it's an act directly from Congress, like EPCRA, it passes both houses of Congress and then is signed by the president. In general, there's not nearly so many questions about what was the intention of the legislators. The very common alternate title for EPCRA is SARA Title III, where SARA stands for the Superfund Amendments and Reauthorization Act of 1986. If you ever hear anybody talking about SARA Title III compliance, they're talking about compliance with the Emergency Planning and Community Right to Know Act. What you've probably figured out by now in your public health studies is that a lot of times public health laws and regulations only occur reactively after something really bad has happened, which kind of shows why it's important to have the regulation in place to prevent the bad thing from happening again. And that was the case with EPCRA as well. Now, the massive tragedy that spurred lawmakers to create EPCRA occurred half a world away, but it was still such a vivid example of how vulnerable we were here in the United States to chemical releases, particularly ones that are near populated areas, that it spurred very quick actions. And we're going to talk about that massive tragedy now. In the overnight hours of December 3rd, 1984, in the town of Bhopal, in the Indian state of Madhya Pradesh, in the central part of the country, there was an unintentional release of methyl isocyanate gas from a Union Carbide plant that was located right in the middle of Bhopal. If you're wondering what methyl isocyanate is used for, it's a precursor chemical for the manufacture of carbamate insecticides, such as carbaryl, better known as 7, and also aldicarb. It's also a profound human toxin. So because this incident happened in the middle of the night, many people in Bhopal were asleep, and as they slept, thousands of them were overcome by this cloud of poison gas, and many of them died from acute poisoning. The current estimate is that 8,000 people in and around Bhopal died more or less immediately after exposure to heavy clouds of methyl isocyanate, and it's estimated that the total death toll might have been closer to 20,000, including people who died later on and in the ensuing days after the spill and the rupture. So what happened was a vessel of methyl isocyanate failed, and then a huge cloud of this MIC gas was blown into the surrounding community. What compounded this tragedy was the fact that there was no alert system in place at the plant. There was no alert put out into the community during the release or immediately after. If there had been, for example, a shelter-in-place alert and people had known to stay in, like to wake up, sort of seal their windows and doors until the crisis had passed, that might have saved some more lives. But unfortunately, that did not occur. What further compounded the tragedy was the fact that many firefighters and other first responders in the community had gotten notifications that something was happening down at the Union Carbide plant, and so they went to the site. but they didn't know the nature of the hazards they were going to face when they went to the site. So they didn't really have their full personal protective equipment. They maybe didn't have the supplied air and other appropriate gear for responding to a chemical release. And so dozens of firefighters and other first responders were overcome as they approached the site, and many of them also died. Again, because they went to where the emergency was, but they did not know the nature of the hazards they were going to face at that site. So I hope you understand this was a massive human tragedy, but it was also entirely preventable. If there had been sirens in the community or some other notification system so that people could have been woken up and then had a chance to maybe apply some defensive measures, some shelter in place measures. This is not the kind of release where evacuation would have been called for. Exactly the opposite. Sheltering in place would have been the appropriate thing, while turning your HVAC system off, sealing up your windows and doors, and waiting it out. If the firefighters and other first responders knew the nature of what they were facing, they would not have went in there without having their appropriate gear, and they wouldn't have died. So in the end, a complete lack of emergency planning and preparation for what should have been a foreseeable event, a vessel under pressure failing that contains a dangerous gas. It's estimated that 20,000 people lost their lives because of this failure to plan and prepare. What I should also note is that Union Carbide was a United States-based company, and they had very similar manufacturing facilities to the one in Bhopal all around the world, including in the United States. And I think it's important to note that this was actually not the case of Union Carbide, of a company locating in India, in this case in Bhopal, in order to avoid safety regulations and standards. Every single Union Carbide plant that existed in the world in the early 1980s, they were all built to the same specifications, whether they were in Bhopal, India, or in China, or in the United States. This was not a case of this plant in particular having more lax safety and regulatory compliance than plants that would be located in the United States. And what stemmed from that was the fact that the press in the United States was very quick to note that, hey, there's that plant where that devastating tragedy happened in Bhopal. We have identical plants processing the same chemicals with the same kinds of high pressure vessels in the United States. There was one in Woodbine, Georgia, and one in Institute, West Virginia. So of course the question was asked, could this kind of tragedy happen here in the United States? So the answer to the question of could this happen here in the United States, it would have been obvious to anybody who was involved in public health and emergency preparedness at the time in the early 1980s, or anyone who had studied the the kind of manufacturing processes that were taking place in the Union Carbide plants right here in the U.S., in Georgia and West Virginia. When the Deputy Administrator of the EPA, Jack McGraw, was interviewed in a trade journal and asked that very question, his response was, yes, of course, it could happen here. And then Mr. McGraw was proven right less than 8 months after the Bhopal disaster when one of those two Union Carbide plants in the U.S., the one in Institute, West Virginia, had an unintentional release of a dangerous gas, aldecarboxime. Thankfully, it was not as acutely poisonous as methyl isocyanate, but still, it was not a harmless gas, and it did result in over 100 hospitalizations of people who lived at or near this plant in Institute, West Virginia. Needless to say, there was a lot of community attention and also media attention on this event. I mean, the Bhopal disaster was still fresh on a lot of people's minds, and this was another Union Carbide plant and another chemical release that had happened in another community that had not been adequately briefed on the hazards, and 100 people had wound up having to be hospitalized because of this cloud. So media coverage of this, plus some other spill incidents that were starting to happen, and we're getting more media coverage, this all created a public desire for to be protected from what's going on behind those plant walls of these facilities in their community, and the public started to demand a right to know what was going on behind those plant walls. The timing was interesting too, because in the year 1985 is when the Occupational Safety and Health Administration, or OSHA, had promulgated a new standard called the Hazard Communication Standard, which included right-to-know elements for people in their workplaces. So in 1985, over the summer of 1985, people at their workplaces were getting new education they had not received before on the hazards of some of the chemicals they were working with in their workplaces. And they were being given what was then known as material safety data sheets, what we now call safety data sheets. Many of them, for the first time, were being made aware of this, and they were being told over and over in their occupational safety and health training that they had a right to know what chemicals they were working with. Well, now the communities and people outside of the workplace were starting to demand a similar right. We want to know what's going on in that facility that occasionally leaks chemicals and that could possibly affect us all. All of this political pressure came together to to make lawmakers feel pressure to do something to ensure the safety and health of people who live near these chemical plants and other facilities that could create a danger to their community. And as a result of that political pressure, they acted kind of quickly. And the EPCRA, or SARA Title III, passed through both the House and Senate and was then signed into law on October 17th, 1986. So less than 2 years after the Bhopal disaster, a little bit over 1 year after the aldicarboxime release in Institute, West Virginia, we had a brand new law, and it was signed into effect by President Ronald Reagan, who was not exactly a fan of governmental regulation, but there was so much political pressure to do something that this law came into being with very little opposition and relatively quickly for congressional action. So what does EPCRA actually do? Well, the most important thing that EPCRA does is it requires covered facilities, and I will talk about what that term means in the next slide. But covered facilities must identify, inventory, and report their quantities of hazardous chemicals that they have on site to state and local government entities. Specifically, they have to submit what are called Tier 2 reports that have to go to the State Emergency Response Commission, which I'll also talk about shortly, local emergency planning committees that cover the areas where the facility is located, and also the local fire departments that cover the area where that facility is located. The Act also established a mechanism for state and local level emergency planning for catastrophic releases from these facilities. Again, just to make sure that the community doesn't get caught off guard and that doesn't multiply the tragedy. EPCRA also mandated the creation of what's now known as the Toxics Release Inventory, or TRI reports. TRI reports are available to the public. They're used as a tool to notify the community and the general public about chemical releases within the facility, even those chemical releases which do not rise to the level of a public health emergency, even if it's a relatively small release that stays within the walls of the plant or the facility. These are still included in the Toxics Release Inventory, and it's publicly available information. The TRI also describes waste management activities at covered facilities, including just the total number of pounds and kilograms of materials that get released either inadvertently or deliberately off-site. So what are some of these covered facilities under EPCRA? Well, these are any private or public facility that possesses one or more of the extremely hazardous substances at levels above a threshold planning quantity. And both the extremely hazardous substances and their threshold planning quantities are both explicitly spelled out in EPCRA. At the present time, there are nearly 500 chemical substances that are on the extremely hazardous substances list, along with their threshold planning quantities. Here's a few examples. Nitric acid. It has a relatively high threshold planning quantity of 1,000 pounds. You can have less than 1,000 pounds of nitric acid on site and not be covered under EPCRA, whereas you have 1,000 or more, you are covered. And hydrous ammonia has a TPQ of 500 pounds. This is important because Farm supply stores such as CAL Ranch and TSC, many of them stock anhydrous ammonia as a fertilizer that's used in a lot of croplands. And so it does not take a lot of anhydrous ammonia for you to become a covered facility. So many of these farm supply stores are actually covered facilities. And that probably makes sense if you think about it, because if you have several hundred pounds of anhydrous ammonia and it's handled incorrectly, either inadvertently or intentionally, it can cause a huge explosion that can devastate a community. Chlorine gas is an important disinfectant, particularly for water pollution, but it's also a highly toxic gas. Its TPQ is only 100 pounds. So this means that almost every single wastewater treatment plant in the United States is a covered facility under EPCRA because they have more than 100 pounds of chlorine on site at any given time. Many larger pools and aquatic facilities also will have more than 100 pounds of chlorine on site at a time, which makes them covered facilities. They have to comply with EPCRA. So the important thing here is that this is not just a law for chemical facilities. It was written with sort of companies like Union Carbide or large petrochemical plants in mind, but its coverage extends down to much smaller entities who you might not think of them as posing a great danger to the community, but they could if those chemicals were mishandled. You can also see exactly how low some of these TPQs are for some of the incredibly acutely toxic chemicals. Look at phosgene, for example. Phosgene is an important precursor chemical in the manufacture of polyurethane, but 10 pounds of phosgene puts you under EPCRA because phosgene is also an intensely toxic well, respiratory toxin, kind of on the same lines as methyl isocyanate. So if you're a facility that maybe previously was not covered under EPCRA, but you acquire one of these extremely hazardous substances at levels above the threshold planning quantity, you have to report this to your local EPA office and to your state emergency response commission within 60 days of becoming eligible, or else that's you can if you do not do that, you can wind up paying a very hefty fine. Covered facilities have some very specific responsibilities under EPCRA, which include the following. They must have an emergency response plan, which is kept and reviewed by local and state officials. And we'll talk about those local and state officials a little bit more in just a minute. When the Act was originally written, the intention was that these emergency response plans have to be made available to the public as well. Now, keep in mind, EPCRA came out in 1986, and it was for about 15 years, the public had a right to know, and they could learn everything that was going on in a plant, not just the chemicals that were there, but they could see the entire emergency response plan, which includes things like consequence analysis of what could happen if this particular vessel erupts, and how many hundreds or thousands of people could be injured or killed as a result of that. Well, after 9/11, there was some the Patriot Act was passed, and then some subsequent amendments of the Patriot Act were also passed. They kind of curtailed some of this information being made available to the public. I mean, you can still see emergency response plans, but there's certain parts of them that you won't be able to see, like the consequence analysis and some of the other really sensitive parts that would, you would not want to have get into the wrong hands. Now, it doesn't mean that there's no availability anymore. You might just have to go to a special reading room now in order to review some of these emergency response plans. You won't be able to make photocopies of them, and you probably have to pass a background check, and you might wind up on a watch list if you ask a lot of questions about some very sensitive items in the emergency response plan. So post 9/11 and post Patriot Act, there's not quite as much public availability of information as there used to be, but there's still still a lot more than before the act, and that's still very important to have. These covered facilities also must do mitigation drills. I mean, obviously you want to do preventive stuff to keep things from happening, but mitigation drills in the event of unexpected vessel failure or something have to be done. I mean, when a disaster is occurring, and mitigation drills can make the difference between an event that's contained within the walls of a plant or facility and one that goes out beyond the facility and becomes a public health or other type of disaster. One of the most critical things that covered facilities must do is they must provide their local emergency responders with updated chemical inventories and also consequence analysis information. These have to be updated on at least an annual basis or any time that a significant change in processes or hazards within a plant occurs or other covered facility. The reason why this is important, I kind of covered it already when we talked about the Bhopal tragedy. If emergency responders respond to an incident and they don't have the proper equipment and training and knowledge of what's going on with what they're facing, it can it can certainly delay emergency response. It can lead to tragedies among emergency responders. You know, people can die, and that's just something that cannot be allowed to happen. So this information must be given and it must be updated. And there's another thing that has to, and there's another reason why it's important as well. Sometimes the emergency responders that are called in when a disaster occurs, that's, for example, a chemical facility, if they've been briefed and they know what's going on, sometimes in their turnout gear, they're the ones that will actually go in there and shut off the valve or, you know, begin to revert or stop the reaction so that the bad thing going on actually stops and so that the levels of community exposure are lessened. So providing their local emergency responders with this chemical inventory and consequence analysis information is an absolutely critical role that covered facilities must do. Another key requirement for covered facilities is that they have to provide potentially affected neighbors, the people who live near the facility who could be impacted by a spill or explosion or other event. They have to be provided with information in order to protect themselves in the event of a spill or release. And in some cases, it has to go beyond just information, and they're actually obligated by state or local governments to provide supplies. For example, a chemical manufacturing facility might be required to provide emergency radios for everybody who lives downwind of the facility, or just some other way of communicating information in the event that a very bad event does occur. For many, for many events, such as the Bhopal disaster and other chemical spills, evacuation isn't necessarily what's needed, but instead sheltering in place, where you try to seal up your home as well as possible so that no entrainment or infiltration of toxic gases and vapors occurs, and then you do that until told that it's safe to open up again. And this is where a lot of times state and local governments will require a facility to provide, for example, 6 mil plastic sheeting and duct tape to every single downwind residence that could be impacted by a spill or release event. This could have saved so many lives in Bhopal if the Union Carbide plant would have had some method of notification to actually let the people outside the plant know that something bad was going on, and if they had provided shelter-in-place instructions and equipment, if people had known to like close their windows and seal up their doors and chimneys and windows until such time as they got the all clear, a lot of lives could have been saved, and honestly would have saved Union Carbide a lot of money as well, because shelter-in-place equipment and infrastructure to provide instructions is a lot less costly than all the payouts that Union Carbide had to do from the wrongful death claims because of what happened due to their negligence. In some cases, the covered facility will actually be obliged by state or local governments to provide antidotes. This happens a lot around nuclear power plants, where for people who live near a nuclear power plant who could be impacted by the immediate fallout events of a partial meltdown or other release, you might actually the plant might be obliged to give all neighbors potassium iodide tablets, because one of the things you want to do is saturate your thyroid as quickly as possible with potassium iodide so that it's blocked, so that radioactive iodine 131, which is a common component of nuclear accident discharges, does not have a chance to bind onto your thyroid. So as you can see, Providing information, and in some cases supplies, is another key responsibility of covered facilities under EPCRA. One key responsibility under this Act, which is given to states, is that they must designate a State Emergency Response Commission, or CERC. Every single state in the Union has one. And what the CERC will do is they will direct and coordinate the actions of local emergency planning committees, which I'll talk about in the next slide. The CERC will also collect and review the EPA Tier 2 and toxic release inventory reports from covered facilities. Again, just to make sure that these covered facilities are doing their EPA reporting correctly and providing correct and up-to-date information to the state and to their local emergency planning committees. Here in the state of Nevada, the CERC has up to 25 members. It's not always fully staffed, but it can have up to 25 members, and they are all appointed by the governor. The CERC members will have a mixture of emergency management personnel, along with people from fire, law enforcement, military, public health knowledge, industry personnel, because it's important to have people who are knowledgeable about, how a petrochemical plant works, or how an oil refinery works, or really just based on the types of covered facilities that exist within their state, trying to make sure that you have some industry personnel in there. It's not their job to sort of advocate for the industry they represent, so much as just to contribute their expertise to emergency preparedness and to emergency preparedness generally. And also there's community members that need to be present in a CERC. EPCRA also created another layer of responsibility and accountability between the state, the Emergency Response Commission, and the covered facilities themselves, and that's the LEPC, or Local Emergency Planning Committee. And the reason why it's important to have these is just to maintain a little bit of more local knowledge, and just, members of an LEPC can actually oftentimes will personally know the personnel who are in charge at these covered facilities, and they will work closely with them. Now, the workings of an LEPC are supervised by the State Emergency Response Commission. What's interesting about LEPCs is they can be pretty large, and based on the way that EPCRA is written, there's a lot of people that are required to be parts of LEPC. There's supposed to be elected state and local officials as part of an LEPC. They're supposed to be representatives of law enforcement, of fire, of civil defense. They're supposed to be experts in first aid and in public health. There's also supposed to be local environmental, hospital, and transportation personnel, members of the broadcast and print media within the catchment basin of the local emergency planning committee's geographic footprint. Also community groups and owners or representatives of covered facilities. So LEPCs can have a lot of members. You probably noticed that public health is involved in LEPCs. And this could be a great opportunity for public health graduates to serve their community. I know for a fact that the Clark County LEPC is often looking for members, and somebody that brings a public health mindset and public health knowledge would probably be welcomed on a local emergency planning committee. So if it's something that interests you, you might want to ask. So how are these divided up here in Nevada? Here in Nevada, it's pretty much done by county, where every single county represents a local emergency planning district. So Clark County has an LEPC, Washoe County has one, Nye County has one. Carson City has its own LEPC because Carson City is essentially a combined city and county entity. So they've got their own LEPC as well. So that's how it's done here in Nevada. Probably the most significant responsibility of a local emergency planning committee is to complete an emergency plan. And yeah, this is different than the emergency response plan that the covered facilities themselves put forth. An LEPC's emergency plan basically covers and encompasses the varieties of hazard that are posed by facilities within that district, or the county in the case of Nevada, where it's all done by county plus Carson City. So the LEPC must draw up an emergency plan that describes the variety of hazards and how the community is prepared to respond to them. The emergency plan from the LEPCs must be updated at least annually, and it must be made available to the public. And there's not usually as many restrictions to public availability for these LEPC emergency plans because they're not going to have exactly the same level of specific consequence analysis information that the covered facilities own emergency response plan will have. So there might be some emergency plans drawn up by LEPCs that are somewhat sensitive and where public availability is somewhat curtailed. Again, in that case, you might have to go to a reading room or not be allowed to make a copy, but you can still see it. Another thing that LAPCs do is they can acquire and utilize resources such as federal and state grants in order to help develop, implement, and exercise their emergency plan, to actually pay for things like community drills, for example, and also to provide public safeguards. I described before about how in some states and local governments will require the covered facilities to provide emergency radios, 6 mil plastic, potassium iodide pills, things like that. Well, in some cases, the LAPC will actually get a grant to cover the expenses of those, and they will actually provide it themselves rather than making the covered facility do it. So that's another responsibility that LAPCs can have. I have covered a lot of emergency planning elements of EPCRA, but the next two initials in that acronym are also very important, CR, or Community Right to Know. There's a significant number of community right to know elements in EPCRA as well, and I'm going to cover those now. As I stated earlier, the emergency response plans that come from covered facilities must be made available to the public. But of course, since the legislation came out, subsequent legislation reduced the availability of certain sections that discuss, for example, the likely consequences of an incident or release, because again, that's not information that you want getting into the wrong hands. But there are still elements of that information that's available, and certainly the county or LAPC level emergency plans are generally made available to the public with little to no restrictions. The toxics release inventory data must be made available to the public. If a covered facility spills a certain amount of chemical per year, they don't necessarily have to say where the spills occurred or in what process, but the actual total amount that's spilled or that escapes the plant walls, that does need to be made available to the public. The Tier 2 reports, which provide information about the types, quantities, and locations of hazardous chemicals. These must also be made available to the public. Now, with that being said, again, thanks to the Patriot Act and subsequent amendments, facilities can opt to withhold information on locations of particular chemicals. In other words, they don't need to tell you exactly where in the facility they keep the methylamine or the anhydrous ammonia or anything like that. They just need to report that they do have it. And the specifics of where it's located can be withheld from the public. And there's a couple reasons why this information can be withheld. I mean, one is the obvious reasons we talked about before, terrorism, the chance that somebody might use that information to sort of maliciously attempt to create a community release event that injures or kills a lot of people. But the other one is actually that has to do with theft and diversion, particularly of chemicals that are used in the manufacture of illicit drugs. A lot of companies that have high quantities of chemicals that are used to make methamphetamine, for example, that are precursors in methamphetamine. They don't really want to make that information available as to where they keep this within their plant because that might make it an attractive target for thieves. So local emergency planning committees, they must provide public notice of their activities, and they have to receive and respond to public comments. That doesn't necessarily mean that they have to have their meetings open to the public. I know the Clark County LAPC does have its meetings open to the public, but it's not explicitly required in EPCRA that LAPC meetings are made open to the public. So I hope you see why I wanted to take a deeper dive into EPCRA. It's an example of a piece of legislation that's probably saved so many lives, has prevented so many disasters and so many injuries from occurring. And just by requiring certain information to be made available and to be shared with the public, with emergency planning committees, with local fire departments, It's just made such a difference. Now, all U.S. facilities that have extremely hazardous substances above a certain threshold planning quantity, and that therefore are deemed to possibly pose a threat to public health if some of those extremely hazardous substances are released, either unintentionally or intentionally. All of these facilities are now covered by an emergency response plan. Public health personnel have a voice in emergency planning, especially at the local level. The public health infrastructure and personnel in a particular county where a covered facility is located have an incredibly powerful voice in emergency planning now, as do other key elements of EMS and fire and emergency and crisis management, and also the citizens. Potentially affected citizens are now knowledgeable and in some cases drilled on how to respond in the immediate aftermath of an incident. And while EPCRA itself was incredibly important in the prevention of injuries and deaths from chemical releases, from hazardous chemical releases, it also gave birth to a couple of other acts from two other administrative agencies that have kind of built upon EPCRA, and now in order to protect employees, the public, and the environment. I talked in the Role of Law lecture a little bit about the OSHA Process Safety Management Standard, which was enacted in 1992. What the Process Safety Management Standard did was that it created conditions within plants so that any types of hazardous chemicals that are being used inside a plant, it sort of tightened up the way that they're used. It introduced management of change, employee training, a whole lot of requirements just to make sure that, well, it was an OSHA standard, so its intention is to protect employees from the consequences of a release. But of course, if you protect employees from a release and the release does not occur, then you also protect the public. And the Environmental Protection Agency has a very similar standard to the Process Safety Management Standard called the RMP, or Risk Management Plan. Very similar requirements. They both basically ensure that processes inside covered facilities or facilities that have threshold planning quantities of hazardous chemicals are very tight, very well regulated, that all sorts of mitigation and prevention strategies occur so that they don't leak out and injure employees or the public. The net result of EPCRA and some of the subsequent legislation that it's birthed, such as PSM and risk management plan standards, is that it's a lot less likely that an event like the Bhopal disaster will happen here. As I have stated in this course, and probably in several different modules throughout the semester, the point of public health really should be to look upstream, to create the best conditions possible so that people can live, work, play in such a way that they do not get exposed to injurious conditions. That even if people don't do everything exactly right, they can still be protected because the environment around them is safer. But we don't live in a perfect world, and so therefore, that's why things like workplace safety training is still important, or other things where individuals get trained on and prepared on what to do when something goes wrong so they can improve their chances of survival, lessen their risk of injury. And preparedness from disasters is the same way. There is some individual and household level effort needed at the present time. That's probably not going to change anytime soon, so this is something we need to go over. We do know that preparedness can require intense efforts on the parts of individuals and households. In some cases, they require extensive allotment of resources that not everybody has, and that's something I'll cover in the next slide. But what's interesting is in 2012, the Centers for Disease Control and Prevention did a study of 14 states, one of which was Nevada. What they found was that they looked at households in these 14 states. Only a little over half of the households, 53.6%, had a 3-day supply of water on hand in the event that they would need it for some reason. Like, for example, the failure of the publicly owned treatment works to provide potable water to them over the course of 3 days. Only about 21% of all households had a written evacuation plan. And you're probably thinking that sounds like a high number. That means more than 1 in 5 actually had a written evacuation plan. The survey, basically, if you had just any kind of rudimentary written information, including just like what you expect to do with your pets in the event that you have to evacuate, for example. that would count as a written evacuation plan, and only 21.1% of households had even something as simple as that. Persons least likely to be prepared were people of color, specifically pe people who are identified as Hispanic. And again, there can be an intense level of effort and resources needed to be prepared for a disaster or some other event. Of those 14 states in this 2012 CDC study, Nevada residents were the least likely to have a 3-day supply of food. Only about 78.5% of the households responding had that. Only about 80% had a 3-day supply of medication, and not even quite 3/4 of the households in Nevada had a working battery-powered radio. So, as you can see, we need to do a lot more to make it easier for people to be prepared at the individual and household level, really all over the U.S., but certainly here in Nevada. If you want to make sure that you as an individual or that your household are prepared in the event of a disaster, first thing you need to think about is what types of emergencies or disasters are most common in your area. Here in southern Nevada, the most reasonably foreseeable disasters we can have would be wildfires, especially if you live anywhere near the urban wildland interface. Earthquakes are surprisingly common in southern Nevada. There's a lot of fault lines that run under Nevada. In fact, Nevada is the third most seismically active state after California and Alaska. Floods are surprisingly common, even though we are in the desert. When floods do occur, sometimes it takes a little while for water to seep into the ground, and it winds up going into a lot of channels and into running across streets and creating some swift water areas that sweep people away. So that's a disaster we need to be prepared for. Extreme weather events, and also civil disturbances. The unfortunate truth is that southern Nevada, and specifically Las Vegas, could be a target for civil disturbance activities, for terrorism activities, because of what Las Vegas represents. So these are the kind of foreseeable emergencies that can happen in our area. You should try to have enough supplies to last for 72 hours in the event that you have to be sort of left on your own for 72 hours without electricity, without resources, without contact with the rest of the world. This means developing a preparedness kit. There are lots of sources online where you can find out how to create a kit or even kits that you can buy. The problem with these are that, of course, they require maintenance, and they require initial outlay of expenditures as well that you might not have, particularly if you're an undergraduate student at UNLV and you maybe don't have a lot of discretionary income. There are some grants that are sometimes available for preparedness kits, but this is the thing that people don't appreciate about them is that canned foods expire. Plastic jugs of water are not, they do eventually spring leaks, especially with the really thin plastic that's used for a lot of water bottles. So preparedness kits, if you do get one assembled, it does require maintenance. You do have to check expiration dates for medicines, for foods, for waters, for things like that. Probably the most important thing you can do that doesn't really cost very much money at all is just create a plan and write it down. Because that way, if something bad does happen, you can go back to your plan and kind of remind yourself of before the disaster occurred, what you were thinking on this and what your plans were. Like, who are you going to touch base with? And it's important to write down phone numbers and actually literally write them down. I know we don't always memorize phone numbers anymore because our phones make it easy that store that information readily, but actually have these numbers written down somewhere and think about what kind of foreseeable emergencies require sheltering in place and what types require evacuation, and be prepared for both. I mean, if you might have to evacuate due to a certain event, such as a wildfire coming close to your home, um, have have in mind what are the things you're going to grab, not just for sentimental reasons, but for actual survival and importance reasons. You don't want to leave behind something that you desperately needed. And think about those emergencies that require sheltering in place. I mean, are you prepared to sort of seal up your doors for several hours and stay inside your house until given instructions? if you do have to do evacuations, think about where you're going to meet. And you might have to have a few different places in mind based on where the disaster is occurring. I mean, you might write down a place, and then it turns out that place is even more impacted by the disaster than where you are now. So again, just think about scenarios and write them down. Make sure to write down if you have out-of-state contacts, people you can reach out to let them know that you're okay once the disaster has passed. That's very important to have that written down as well. And again, make sure those numbers are not just stored in your phone, but written somewhere. In summary, governments at all levels have an important role to play in assuring that there's adequate levels of emergency planning and preparedness, again, for the reasonably foreseeable emergencies and disasters that can occur within your community, within your county, within your state. Governments have an important role to play in prevention for disasters that can be prevented. That's where, for example, EPCRA and the PSM standard, those are examples of federal legislation that prevent, or in some cases mitigate, high casualty disasters, in this case from chemical releases. For disasters that cannot completely be prevented, such as earthquakes, wildfires, things like that, governments have an important role to play at all levels in preparedness before the event, and then in response, mitigation, and recovery for disasters that cannot be completely prevented. And as resources allow, all persons should do what they can to prepare for reasonably foreseeable disasters. Again, keeping in mind that emergency kits are not cheap and things do expire. That's it for this week. Let me know if you have any questions or concerns. Thanks for your attention today.